Hi, here we will discuss about how breastfeeding improves the neurological development of your child and how breastfeeding improves the immunity of your child. And also, we will see how we will monitor the neurological development of your child and what are the vaccines that are available for your growing child. So, breastfeeding and neurological development. Studies have shown that breastfeeding is associated with earlier ability of the baby to crawl and perform a pincer grasp. A pincer grasp is ability to hold an object between your thumb and index finger. And the infants who were exclusively breastfed for at least 4 months were 50% less likely to have gross motor coordination delays than those who were never breastfed. Cognitive development. The babies who were breastfed were shown to have higher intelligence quotient, and they were shown to have, the longer the duration of breastfeed, they were shown to have a higher ability to be productive in their adult life. And being more productive, they were able to earn more salary and more economic development in these children when they grew up as adults. The school performance were also exceeding in babies who were breastfed when compared to those who were never breastfed at the age of 5 years. Breastfeeding also improves the baby's ability to fight against infection. Colostrum, which is the first milk produced from the mother after giving birth, is rich in antibodies. There are secretory IgA antibodies. These antibodies are a key component of breast milk's ability to protect the baby against infection. Lactoferrin, which is a bacteria killing molecule, and it is present in the breast milk and also protects against bacterial infection. In the breast milk, there is the white blood corpuscles or WBCs or leukocytes, macrophages. These cells are present in colostrum and they play a role in the infant's immune response. Therefore, breast milk protects the baby against several infections: the ear infection, the stomach infection, the lung infections like pneumonia, from respiratory syncytial virus infection, from whooping cough. It protects the baby from diarrhea, from vomiting, it protects the preterm babies from a lethal intestinal disease like the necrotizing enterocolitis. It protects the baby against meningitis, from asthma, from sudden infant death syndrome, where the baby dies, and childhood obesity. It protects the baby from allergic skin disease called eczema, type 2 diabetes, the obesity, and even from cancers like lymphoma and leukemia. Therefore, the World Health Organization recommends exclusive breastfeeding for the first 6 months and continued breastfeeding while introducing complementary feed in the first 2 years and beyond. Now let's come to how to monitor the child's neurological development. We can use multiple tools, and one of the tools is the Trivandrum Development Screening Chart. Now, the Trivandrum Development Screening Chart can be used for children who are less than 3 years of age, and it contains 27 items that covers the motor ability of the child, the vision development, the hearing development, the personal development, the social development, language development, and it helps in identifying development delay. We have another tool called the Language Evaluation Scale, Trivandrum, which is also used between 0 to 3 years. And there are 33 items here, and here we can assess the child's vision, then the hearing, then the receptive communication, that is the ability of the child to listen to speech and to understand the speech, then the expressive communication, that is the ability of the child to express through words, to vocalize words, speech, and it helps in identifying early identification of communication disorders, the autism disorder. Autism is basically disease where the child has difficulty in speech, in social ability, and also the learning ability. And the specific learning disorders can also be detected. This is the Trivandrum Development Screening Chart, which is used between 0 to 3 years. And on x-axis, you have age in months, and above you have the different development milestones and the range of age at which these milestones appear in the child. So up to 2 months, the child will be able to smile socially. That is, when you smile, the child will smile back. And by 3 months, the child will follow its eyes, follow the object or pen or pencil. By 4 months, the child will be able to, or 3 months, the child will be able to hold the head steadily. By 5 months, the child will be able to roll from back to stomach. And by 6, 7 months, the child will be able to transfer the or turn the head to sound of the bell or rattle. And by 7 months, sorry, by 6 months, the child will be able to turn the head to sound of bell or rattle. And by 7 months, transfer the object from hand to hand. And by 11 months, the child will be able to rise self to sitting position. That is a long range from 6 months to 11 months. And by 11 months, the child will be able to stand up by furniture. And by 11 months, the child will be able to hold a pellet in his hand. And by 12 months, the child will be playing a game called patter kick. That means clapping the hands while listening to nursery rhymes. And by 12 months, by 13 months, the child will be able to walk with help. And by 16 months, the child throws ball. And by 17 months, the child walks alone. That is a long range that can start from 10 months to 17 months. And by 14 months, the child will be able to say 2 words. And by 19 months, not by 14 months, by 19 months, the child will be able to say 2 words. And by 19 months, the child will be able to walk backwards, and the child will be able to walk upstairs with help by around 2 years. Again, it's a long range from 1 to 2 years. And by 2 years, the child will be able to point to parts of a doll, at least 3 parts. And by 25 months, the child will be able to remove its clothes. And by 27 months, the child will be able to use words for personal needs. And between 26 to 29 months, the child will be able to jump in a place. And between 27 to 30 months, the child will be able to differentiate between big and small objects. Between 26 to 31st month, the child will be able to point to 7 common objects. Between 23rd to 32 months, the child will be able to brush teeth with help. Between 30 to 33 months, the child will be able to tell the gender of the child, between whether the child is boy or a girl. And between 23 months to 35 months, the child will be able to answer at least half understandable to others. And between 33 to 36 months, the child will be able to follow instructions to place objects in, on, or under any other object. And the child will be able to answer simple questions between 30 to 36 months. This is the Trivandrum Development Screening Chart. And if your child has a development milestone delayed, then you can pick very easily using this chart. Then you have the language evaluation scale Trivandrum, which is used between 0 to 3 years. And here also on x-axis, you have the age in months. And on above that, you have the various development milestone in the language. By around 1 month, the baby responds to bell, rattle, or clap. And by 2 months, the baby responds by smiling. By 3 months, the baby vocalizes 2 or more syllables. By 5 months, the baby looks, turns head to speakers, voice, or sounds of toys. By 5 months, the baby responds to own name. By 6 months, the baby recognizes words like daddy, mama, tata. And by 9 months, the baby listens when spoken to. And by 9 months, the Baby says dada, mama, or other non-specific words. By 12 months, the baby listens to adult speech sounds, intonation patterns, or like games. And by 12 months, the baby responds to requests. By 12 months or 1 year, uses one word. And by 12 months, responds to music by bodily movement. By 14 months, the baby has sustained interest for 2 minutes in one picture. By 15 months, the baby points to object or toys when asked. By 15 months, uses voice to pointing. And by 16 months, recognizes parts of body. By 20 months, follows simple commands. By 21 months, understands in distinction between personal pronouns. And by 21 months, speaks vocabulary of 10 to 20 words. By 20, 23 months, 24 months, the baby pretends with the dolls or his or herself. And by 24 months, the shows interest in sounds of TV. By 25th month, combines words. And by 27 words, identify names of family members. By 27 months, ask for personal needs. And by 28 months, understand the concept of one. And by 29 months, the name for pictures, that is by 2 years. And by 30 months, listens to stories and rhymes. And by 33 months, gives own name when asked and understand common adjectives and tells gender when asked. And by 36 months, use three-word sentences and knows some spatial concepts. Now let us understand what are the different milestones that usually appear and when you should be able to report to your child doctor if there is any delay in development. So what most babies do by 2 to 3 months is that they recognize their mother's face, develop social smile, and make eye contact, and rise head at times when on tummy, moves both arms and both legs when excited, and keep hands open and relaxed. The parenting tips by 2 to 3 months is that we can give massage, gentle stretch, and exercise arms and legs of babies. Use oil for that purpose also. Encourage babies to lie on tummy for some time every day. Cuddle and play with the babies daily. Cuddling or quickly responding to each cry does not spoil babies. Don't get afraid to do that. Talk to babies in your mother tongue daily. Hang colorful moving object at 30 centimeters, 1 feet away for babies to focus on and follow. Avoid use of digital media in children younger than 2 years. The danger signs which if found you should report to your child doctor is that by 3 months your child is not socially smiling and does not make any eye contact when being fed, cuddled or spoken to, has persistent squint after 2 months, and does not startle, wake up, or cry in response to sudden loud noise, and head pushed back with stiff arms and legs, persistently holding thumb inside the palm with hands kept open or fisted. Now, what are the development milestones which is seen in most babies by 6 months of age? By 6 months of age, they can keep their head steady when held upright and can sit with support. They can turn the head towards the direction of sound, and they can attempt to reach and grasp an object, laugh aloud or make squealing sound, begin to babble e, oo, other than when crying, like to look at self in a mirror. The parenting tips by 6 months is to communicate with babies, imitate their sound, praise them when they imitate yours, put interesting things on the floor for babies to reach out and explore, take the child to outdoors and introduce them to the outside world. The children usually suck on their fingers and thumb for comfort, but it is not a cause for concern. Do not stop or remove the hand from their mouth at this early age. Danger signs are that at 6 months, if the child is not having head control, not able to sit up even with help, does not grasp things within the reach, does not vocalize by making different sounds such as e, oo, and head and eyes do not move to follow track or track a moving object, unable to rise head when on tummy. Now let us see what are the development milestones that usually babies acquire by 9 months of age. By 9 months of age, they will be able to roll over in both directions. They will be able to grasp a toy by using all fingers and turn head to visually follow familiar faces in toys. Look for toys that have been hidden in front of them. Respond to name being called. The parenting tips by 9 months is that let the child drop, bang, and throw things repeatedly. Respond to noise that the child makes in a gentle and patient manner. Give the child clean, safe, and household utensils to play and explore. Play games like peekaboo. That means you can hide your face with a cloth and then suddenly drop the cloth so that the baby can see your face. So peekaboo is a good game that you can play at this age at 9 months. Hide the children's or the child's favorite toys under a cloth or box and see if the child can find it. Now, the danger signs that you should observe at 9 months, which if seen is you should report to the child specialist, is that by 9 months the child is not able to roll over, not able to sit with support, needs support while sitting, does not turn towards the sound, does not utter monosyllable like pa, 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 ma, ba, ba, etc. Tilts head always to one side each time when looking at objects. Now let us see what are the milestones that a child who is 1 year old can do. A 1 year old child can sit without support and reach for toys without falling. Raise arms to be picked up. Crawl to get desired toys without bumping into any object. Use one or two common words in mother tongue and respond to simple requests like no or come here. The parenting tips for a parent of a 1 year old is you can place a toy slightly out of reach to encourage standing and walking while using support. While exploring, the babies might hurt others accidentally. Show them how to touch gently and do not shout at them. Tell your babies stories and read picture books aloud. Show and name things in their environment. Now, what are the danger signs which is present by 1 year? You should report to your child specialist. If the child is not able to pick small object with finger and thumb, the child is not stretching hands to be picked up, and does not respond to the child's name, does not search for half-hidden toys that the child sees you hide, and does not play social games like peekaboo. Now, what are the development milestones or the abilities of a child that the child acquires 1.5 years? A 1.5 year old child will be able to stand and take several independent steps, use a variety of familiar gestures like waving and clapping, can put pebbles, small object in a container, can name and identify common objects and their pictures in a book. So the parenting tip of a child of 1.5 year old is that provide a push toy for babies to learn walking. Give some fruits, toys, etc. to children and ask them to identify the object. Put them in and take them out of containers. Ask them to put them in and take them out of containers. Ask your children simple questions and encourage them to answer. Encourage them to talk. And then what are the danger signs that you should see in a 1.5 year old which you should report to your child specialist? If the child is not able to stand his or her own without support, if the child is not able to put small object in a container, the child does not point to object when named, the child is not responding to mother's gestures and seem to be in his or her own world, the child is not using both hands for everyday activity and shows preference of one hand. The child is not saying single words like mama and dada. Now let us understand what are the milestones that a child of 2 year old can do. A child of 2 year old can walk steadily even while pulling a toy. The child can imitate household chores and correctly point out and name one or more body parts in person or in books. The parenting tip here at 2 year old is that we can provide opportunity for the child to walk, run, and climb in safe environment. We can provide the child, allow the child to imitate you and master their skills, and be patient with them if they make a mess. Encourage the child to follow a daily routine such as sleeping and waking at a fixed time. Read loud to the child, often repeating stories. Provide books, paper, chalk, colors for scribbling. Danger signs at 2-year-old is that the child is not able to walk steadily while pulling a toy. Child is not scribbling on a paper. The child is not using two-word phrases such as give milk. The child is not making appropriate response to gestures such as a response to bye bye, namaste, and does not point to body parts and does not seem to understand and follow simple instruction like give me block like that. Now the what are the now let us see what are the abilities of a child by 3-year-old 3 years. A 3-year-old child can drink from a cup without spilling, can name most familiar things consistently like cat, dog, bird, identify colors and shapes, make a sentence by joining three or more words, and can climb up and down the stairs. The parenting tip for a 3-year-old child is that you can play with the child in the outdoor games with your child with which requires movement and physical activity. You can give variety of materials including blocks, puzzles, rings to the child and allow the child to use their hands and fingers in different ways to improve their skill. The danger signs which you should watch for in a 3-year-old child is that they have trouble climbing up and climbing down stairs, and they cannot eat without help, and and they are not communicating meaningfully and frequently repeating others' speech. And when you ask what is your name, the child responds your name. So it's not a meaningful conversation, and the child is not playing pretend games like playing with a toy. The child is not is continuously drooling and has unclear speech. Does not speak in simple three-word sentences such as "Mommy, give milk." So we have a long list of development milestones which may be confusing. So in order to remember simply, we can just remember four things. If the child is not smiling socially by 2 months, if the child is not holding head by 4 months, the child is not sitting by 8 months, and the child is not standing by 12 months, then you should consider informing your child doctor. For preterm babies, there is something called development supportive therapy, which improves the development of the child while the baby is in NICU and also at home. For preterm babies, the mother can do kangaroo mother care, which is holding the child on skin to skin contact, which also helps in the development of the child. For babies with a delayed development, there is something called stimulation or early intervention. You can have psychomotor stimulation and also psychosocial stimulation as per the development therapist and development pediatrician advice. And apart from development screening, you can also screen the child for birth defect, for critical cyanotic heart disease using pulse oximeter, for hearing deficit using a hear test like acoustic emission and Pera test, which is brainstem evoke response audiometry. We can have blood sampling for metabolic disease like hypothyroidism or G6PD deficiency, phenylketonuria, or congenital adrenal hyperplasia. For preterm babies, we can check for vision like retinopathy of prematurity screening, and you can check for any intracranial problem inside head like bleeding and brain disease using ultrasound. We can also make sure that all the above screening is completed, and if there is any problem, we can involve the child doctor for the management. For the birth defect, you can have charts like this where you will check the baby's body from head to toe. From head, you can have problems like neural tube defect. There can be problem in the shape of the face. There can be problem in the eyelid, eyeball, inside eye, like the cataract, and there can be problem of the size of the ear and shape of the ear. There can be problem of mouth and lip, like cleft lip and cleft palate. Then problems in the abdomen, the urinary tract, the genitalia, the limbs, the chromosomal problems like Down syndrome. Then there is a condition called the autism, where the child, where you detect the autism by around 3 years or above. If a child has problem in social communication and cognition areas, such a child will be aloof in manner, and the child stays withdrawn, does not interact or play with other child. The child appears deaf sometimes. The child does not respond when addressed or called, and they have restricted or repetitive attachment to objects. They may appear to be attached to certain toys or objects, and these attachments may seem inappropriate at times. They use adult's hand to indicate matter of interest. Takes an adult's help to indicate the desired object, but mechanically or without an interaction or eye contact. They will do it mechanically without an interaction or eye contact. They can avoid eye contact. They may avoid eye contact with other people interacting with them. Then they can exhibit unusual behavior. For example, hand flapping, twisting, rocking, swaying, walking on tiptoes, and they prefer not to be touched or hugged or cuddled, and sometimes feels uncomfortable and prefers not to be hugged or touched by people. And they may lack imaginative play. Play is often solitary and passive and not creative. They may not respond to normal teaching methods. Conventional teaching methods may not be effective in such a child's development. And they may have, however, peculiar or special skills like activities showcase special skills such as single word reading, music, art, puzzle, memory, or calculation skills. So they may have certain special skills. Now coming to what are the vaccines that are available for your child. So when your child is born, the child may get the TB vaccine, the BCG, the oral polio vaccine, and the hepatitis B vaccine. Within 6 months, the child will have at around 1 to 2 months gap the oral polio vaccine, injection polio vaccine, the pentavalent vaccine, which contains the diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenza type B vaccine. The pneumococcus conjugate vaccine, that is the vaccine against pneumococci, then the rotavirus vaccine, which causes diarrhea. At 6 months, you have the influenza vaccine, which is useful, especially in preterm babies. At 9 months, you have the measles, mumps, rubella vaccine. And at 15 months, you have the measles, mumps, rubella second dose, and even the chickenpox vaccine. At 1 year, you have the hepatitis A vaccine. So this is the simple chart the vaccination book has, which has the area for indicating the date and the various vaccines. And at 16 to 24 months, you have vaccines like the DPT, the diphtheria, pertussis, tetanus, the Japanese encephalitis vaccine, which is given in some parts of India. And at 5 to 6 years, you have again a booster dose of the diphtheria, pertussis, tetanus. This is the second booster dose. At 10 years, you can have the TT dose and even the cervical cancer vaccine, that is the Gardasil. And at 16 years, depending on whether the child has injuries, you can have a TT in once in 5 years. Then you have the vitamin A schedule also, which is once in 6 months, starting from 6 months of age to 5 years of age. And then with this, I would like to end today's video. I hope you understood what are the development milestones that a child can acquire and how breastfeeding improves the child's development and how breastfeeding improves the child's immunity and what are the vaccines that are available for the child. Thank you very much.